Every single minute of every day, your heart is pumping life through miles of biological pipelines. But what if the earliest signs of a catastrophic failure aren't felt as a heavy, crushing pain in your chest? What if, instead, they're seen right at the tips of your fingers? Welcome to A Critical Explainer, where we're launching a high-stakes medical investigation into what we call the microvascular window. Look down at your hands right now. Go ahead, really look at them. Are your body's most critical warning signs just hiding there in plain sight? The terrifying reality is that, especially for adults over 45, the risk of silent developing heart disease is actively recording itself in real time at the very edges of your extremities. Okay, let's dive into part one, the hidden microvascular warning. It all starts right here with the nail matrix. Basically, this is a layer of living, breathing cells tucked just beneath the base of each nail. These cells are in constant, intimate contact with your bloodstream. They rely entirely on the absolute smallest blood vessels in your entire body, your capillaries. Because these vessels are so incredibly microscopic, they act as the ultimate early warning system. When your heart's output drops even a fraction, these tiny vessels are the very first to struggle, literally gasping for systemic oxygen. And here's the clinical reality we really have to face. After age 45, decades of incredible cardiovascular efficiency subtly begin to narrow. Now, your body certainly isn't broken, but it no longer has those massive biological reserves it did in your 20s to just mask early arterial or cardiac dysfunction. The margin for quiet dysfunction becomes razor thin, and honestly, the symptoms have nowhere left to hide. Moving on to Section 2, cyanosis, the oxygen crisis. Now, what's absolutely crucial about this slide is understanding the distinction between a severe warning and an absolute drop-everything emergency. Peripheral cyanosis is this gradual, insidious microvascular decline. It causes a bluish or purplish tint strictly at the nail bases. It's a severe warning that your circulation is failing. Central cyanosis, on the other hand, means your nails, your lips, and your tongue are all turning blue. That is an immediate medical emergency of complete oxygen failure. If you ever see this, you need an ambulance, no questions asked. Consider the clinical case of Frank, a retired postal worker. For almost a whole year, he just ignored this subtle purplish shift at his nail bases. He just blamed it on getting older, poor circulation, and the cold weather. It wasn't until his daughter noticed the color and really pushed for a doctor's visit that a clinical echocardiogram was ordered. The result? Early-stage heart failure. Because he finally acted on that gradual purplish shift, Frank was put on manageable medication, completely dodging a catastrophic, likely fatal hospital admission. Section 3. Plaque and brittle nails. This is a very dangerous pattern. You see, the exact same plaque that triggers fatal strokes is simultaneously starving your hands. Look closely at these three symptoms, because together they form a highly dangerous biological pattern of peripheral artery disease, or PAD. We're talking brittle and slow-growing nails, chronically cold hands and feet, and claudication, which is this heavy leg cramping that only resolves when you actually stop walking and rest. If you have this pattern, it is a biological guarantee that plaque in your extremities means plaque is actively building near your heart or your brain. Eleanor's case is a prime example of this silent threat. She was an avid gardener, but she dismissed her breaking, splitting nails as just a frustrating side effect of aging for 18 long months. It wasn't until she casually mentioned to her doctor that her legs felt incredibly heavy while walking uphill that he ordered an ankle brachial index, or ABI test. It uncovered moderate peripheral artery disease. Aggressive, immediate intervention prevented a major cardiovascular event. Her nails had literally been screaming for help for nearly 2 years. Which brings us to Section 4, the capillary refill test. Let's assess your own hands right now. We're going to pivot for a second to a real-time interactive diagnostic procedure. I want you to actually follow these steps with me. First, hold your hand up at heart level. Second, press down firmly on your index fingernail for 2 solid seconds until you see the blood push out and the nail turns white. Third, release the pressure and strictly count the exact seconds it takes for the normal pink color to rush back in. Cardiologists use this exact method every single day to instantly gauge sluggish microvascular recovery. So the crucial point here is 3 seconds. In a healthy adult, that pink color returns in under 2 seconds. If it takes 3 seconds or longer, and you're seeing this repeatedly across multiple fingers, your circulatory reserve is actively failing. This exact test actually saved Walter from Kansas. He watched a health program, did the test, and counted a full 5 seconds before the color returned. He repeated it across his fingers, same exact result. He immediately called his doctor, triggering a full cardiovascular workup. And thank goodness he did, because they discovered undiagnosed atrial fibrillation. Walter's simple self-check caught a highly irregular heartbeat and secured life-saving anticoagulation therapy before it could manifest as a deadly blood clot to his brain.
Section 5. The vanishing lunula, a true diagnostic flare.
This brings us to the final and honestly perhaps most actively ignored physical sign on the human body. The lunula is that visible whitish crescent at the base of your nail. It literally shows active, real-time new tissue formation. Now, missing lunulas on your pinky fingers, completely normal. But the sudden vanishing of lunulas on your thumbs and index fingers, that is a severe diagnostic distress flare from your body that you simply cannot afford to ignore.
And this brilliantly illustrates exactly why. There are terrifying clinical associations tied directly to the shifting colors of that nail bed. A reddish lunula indicates congestive heart failure or severe rheumatic strain. A bluish lunula points directly back to profound circulation deficits and cyanosis. And a pale, faded lunula that completely blends into the nail, that is a major red flag for severe anemia. Let's look at Dorothy, a 72-year-old grandmother. She jokingly mentioned to her daughter, but her white half-moons had completely disappeared. That reluctant, almost accidental doctor's visit prompted a complete blood count and a cardiac risk assessment. The result? Uncovering severe anemia and early, silent heart strain. Dismissing those disappearing lunulas delays crucial life-saving blood work by years. Finally, preventative protocols, your medical playbook. Now, let's transition to the essential preventative clinical protocols. This is the highly urgent, actionable conclusion of this explainer, and I need you to execute these steps strictly and objectively today. 1. Examine your bare nails in natural daylight. 2. Perform that capillary refill test on multiple fingers. 3. Note the exact presence and color of your lunulas. 4. Photograph your hands right now to document a timeline of changes. Visual records are a required, invaluable asset for your clinician. When you observe these signs, you kind of have to bypass those standard 15-minute appointment constraints with these exact clinical action items. Don't just ask for a general checkup. Request an ankle brachial index test. Ask for an echocardiogram. Demand a complete blood count. Take absolute command of your clinical evaluation. But please hear me clearly on this with absolute clinical gravity. Do not self-diagnose. These microvascular signals are triggers for professional, aggressive clinical investigation. They require a comprehensive medical assessment, a deep history review, and expert clinical translation by a physician. They are vital warnings, not ultimate diagnoses in isolation. We've looked at the hard evidence today. The microvascular window is wide open. Your body is speaking to you. Are you ready to listen? Take immediate control of your health today. Schedule that appointment if you see these signs, and please share this explainer with someone whose life might literally depend on it.